to Nevada Newsmakers with Sam Shad.
And back on Nevada Newsmakers, we continue our conversation talking about the implementation of Obamacare in Nevada with Valerie Clark and Larry Harrison.
So we talked a little bit about the Silver State Exchange, and the governor actually got criticized by the conservatives for actually starting the exchange in Nevada, but the option then was to let the feds come in and do it, because every state's going to have an exchange whether they do it or not. But like you just said, Nevada is ahead of the curve. So why is it a good thing that Nevada is actually pursuing the Silver State Exchange?
Well, I believe we just have such a diverse population, and I think Nevadans want to be in control of something as big as an exchange in their state. We don't want out-of-state entities coming in, not understanding how we operate, not understanding our unique needs and our unique variables, and setting up something that may not work for us. I think we've got a good group of people on that board, very diverse, very committed. John Hager, as the executive director, is doing a fabulous job. And
he was on the show just recently.
Yeah, we are well ahead of the game if you compare us to other states, especially states with Republican governors. So I'm very proud of the work they're doing there.
And are we going to be able to buy health insurance from other states or from companies operating in other states as part of this health exchange?
I don't see that right now, and I don't know that from a consumer protection standpoint we necessarily want to explore that option at this point. I think there's a lot of vetting to be done with that idea before we jump into a boat like that.
Who does buy in the exchange? Does an individual or does a company?
Yes.
Okay, there you go.
All right, so that brings up the question, which is obviously, and rightly so, brokers, get a fee for selling insurance. Is there going to be a conflict between buying directly from an exchange versus buying from a broker? Is it going to be less expensive to buy from the exchange, and what does that do to your industry?
No. We technically do not get paid by the insurance companies. We get paid by our clients. And we are not a part of the insurance company's profit. Okay? It's a pass-through. They pay insurance for a March 1st effective date. We get paid in April. They don't keep that money for years or months or for their quarterly reports. That money is a complete pass-through. So the premium for an health insurance plan inside or outside the exchange, the premiums are exactly the same. We do not charge for what we do, and the premiums cannot be modified by 1 penny by going to a broker. So I tell my employers all the time, consider me a non-paid employee, because the rates are the rates.
Okay. One of the other things I keep hearing about, the Obama Act says that any company with 50 or less employees does not have to provide insurance. So I'm hearing companies letting staff go and getting down below that magical number of 30 hours a week is the full-time equivalent. Are you seeing this happening, and will this work if people actually get under that 50?
Well, whether it works or not, I couldn't say, but I will tell you we do have employers who are just over that cusp that are concerned about the changes that they would have to make to survive, the mandates and the compliance issues that they would have to fall under. So I do have clients that are seriously looking at whether to go over that 50 employee threshold. It's just a very natural consideration. We're doing everything we can to educate and help people understand. At the end of the day, that's a decision they have to make.
But it's not even the 50, it's the full-time equivalent of hours and stuff. So you might have 70 employees that are all part-time, but would you still qualify and have to provide health care?
Yes. So a full-time equivalent would be 2 15-hour weekly employees, equates to 1 full-time equivalent.
Okay.
So there's that. And, we've heard people say that this is a job-killing bill. And we'll wait and see if employers do, in fact, lay people off. There's also, as they're playing this chess game, well, maybe I'll just break up different entities and have different federal ID numbers. However, if there is 80% common ownership, it's not going to work. Just the same as the way that the federal government counts people for 401ks. If there is common ownership, then it is one entity, regardless of whether they have separate federal ID numbers.
One of the big dogs, the big dog in the state as far as insurance goes, is United Healthcare. What is their view on what's going on and the part they're playing in it?
I would have to ask them.
I mean, they were in my office yesterday, and I think it depends. Every day is a different answer, because this thing, as it unfolds, you start to recognize different idiosyncrasies and things about it that you didn't really understand 3 weeks earlier. And so every day you will get a different answer out of every carrier. I mean, just yesterday I asked my individual representative from United Healthcare if they were going to be in this exchange, and even that person didn't know for sure. And if they were, what plans would they offer? I mean, and every day is a different day. What the answer was yesterday could be completely different next week.
Well, when you look at the country essentially providing 30 million more plus new people into the insurance business who are not currently insured, you would think that everybody would want a piece of that pie.
Well,
quick, brief answer.
Who are these people?
And are they willing to pay?
The first wave of people going into the exchanges are going to be the sick. And do the carriers want to take on that?
Okay, and that's where we got to leave it. Obviously, lots more to come on this topic. Thank you both very much.
Sure.
Very, very illuminating. We'll be right back on Nevada Newsmakers after this timeout.